You're watching ABC4 News.
National Healthcare Decision Day is tomorrow, April 16th. The day is an initiative to encourage patients to make advance directives or to discuss their wishes about future healthcare decisions and put them in writing. Joining us today is Dr. Dominic Moore. He's a pediatric palliative care physician with University of Utah Health and a medical director of palliative care at Intermountain Healthcare. Doctor, thanks so much for joining us. First of all, let's just kind of iron out the details of what exactly an advance directive is.
You bet. Thanks for having me. You know, an advance directive is a way for people to know you and for people to know what's important to you and how you'd like to make decisions if you have a medical emergency. It's tough because sometimes we can't speak for ourselves when an emergency happens, and that means that we need to let people know what's most important, and if we can't speak for ourselves, who ought to speak for us?
It's a topic that's heavy, and for a lot of people something they don't necessarily want to think about, but they need to. So I guess my next question would be, if you have one in place, can you update it? Can you change if you've kind of had a life change and you want to make things look a little different? So even if you have one set in stone, can you alter it if it needs to be?
That's a great question. Yeah, these can always be altered. They really should be up to date, and that's part of the idea with this National Day, is that we have a time to remember. So for some people, they change when there's a new diagnosis or something that changes about your health in general. For some people, they change when you're maybe going downhill, your health is not going so well. For some people, it's an unhappy event like a divorce that might happen. We recently had someone who needed to have their advance directive updated because their ex was their decision maker and they didn't like that idea very much. And then finally, making sure that your designated person is the right person. Sometimes a friend or a family member agrees to be your designated medical decision maker, and then something changes with them in their life, their health. Sometimes we've even had people who come in with a designated medical decision maker who's passed away.
Okay, well that won't work. So these things need to be updated and make sure that they're current. Do you need a lawyer to fill out these forms, or is it something you can just do on your own?
You know, thankfully in Utah you don't. Often people fill them out with their lawyer when they're putting together their will or other similar documents. But really you just need one qualified witness, and that's a person who's 18 years or older and who doesn't really have a stake in your healthcare decision. So it can't be the person that you name as your decision maker, but it could be a neighbor, it could be a friend, it could be a coworker.
You know, Dr. Moore, I had not thought about this until I was about ready to have my first child, and the hospital said, you got to do this. So what would be your suggestion to everybody out there watching today? I would guess it's just be to do it, but what would be your final encouragement for everyone who might be watching us right now?
You know, if we learned anything in the last 12 months is that anything can happen. And what we hear often from families is that it feels too soon until it's too late. And I guess I would leave you with the fact that when you do take care of this and when you do think through this, it is a great gift that you give your family. It allows them, if something does happen to you, to spend that time loving you and thinking about you and supporting each other rather than grappling through some really difficult decisions.
Okay, so well said. Thanks so much, Dr. Moore, for joining us today. More information and these forms can be found online at abc4.com. We'll connect you there with the Intermountain website. Thanks so much for joining us, and we'll be right back.